that, we are back to testing infusion pumps, which is our topic of the conversation today. We will cover a lot of ground today. We will start with the overall clinical application of infusion devices. We will talk about the role that infusion pumps play in the hospital environment and any other environment where they may be used. We will then transition into the infusion device test procedure, where we will review several different tests and different test methods, and we will talk about how to choose the one that is right for you. And finally, we will provide you with a few tips that we believe could help you optimize your strategy when it comes to infusion pumps. So as usual, we will start with the basics. So what is an infusion pump? An infusion pump or an IV pump is a medical device that delivers fluids such as nutrients and medications into a patient's body in controlled amounts. So this technology was developed on purpose. It was developed to enable the administration of fluids that would be difficult or expensive to deliver manually by medical professionals. IV pumps are sensitive enough to be able to deliver amounts as small as 0.1 milliliter of fluid per hour, which is very small. It's too small to be given, with a drip. Infusion pumps can be programmed to deliver medication every minute or to deliver different volumes of fluid at different times. All of that is way more cost effective when controlled by an IV pump as opposed to paying for staff members to administer that. There's a significant number of infusion devices in hospitals and clinics worldwide. They are used to control the delivery of a wide range of medications, nutrition, or blood products. In anesthesia, for example, an infusion device controls the delivery of narcotics, short-acting barbiturates, paralytics for patient analgesia, amnesia, paralysis, and sedation. In the ICU environment, they're used for sedation and paralysis, as well as for infusing medications that would help speed up the healing process of a disease or of a chronic condition. And of course, patients can also use IV pumps at home for also a variety of different reasons.
This is Jerry. I think one of the big things that we may or may not be thinking about is how important testing of these is because of some of the things like narcotics, for example, that are delivered from or through them. Another application is chemotherapy. So when we treat cancer in a patient with chemotherapy, we are purposely trying to kill the cancer. But if we deliver too much chemotherapy, we actually kill the patient and the cancer. That's not the optimal way result that we're looking for. So when these kinds of fluids are delivered through these pumps, they become even more important to make sure they are absolutely properly functioning. And we'll go into some of the things about what can go wrong a little bit later in this presentation. But just keep in mind, there's so many patients that are being treated with chemotherapy and cancer right now in the hospitals. There's so much going on with pain management for all kinds of reasons in the hospital, whether the patient went to surgery or whether they did not. So just keep those things in mind when you're thinking about, well, why do I bother testing these infusion devices? Because they belong to the company that we get the infusion sets and the fluid bags from. Well, no, they kind of fall in your responsibility to make sure they're safe and effective for clinical use.
Yes, exactly. And like Jerry just mentioned, we will be diving much deeper into the importance of testing of infusion pumps and also a variety of different methods to do that to ensure patient safety. Now let's move on to the categorization into the classification of infusion pumps. Just as we mentioned, there are many types of infusion pumps. However, the most common classification is to divide them into the two main categories of the large volume pumps and small volume pumps. Large volume pumps, they are being used to for fluid replacement, such as saline solution. They're used for medications, such as antibiotics, or for nutrient solutions that are large enough to feed a patient. And there are also small volume pumps that infuse hormones, such as insulin, or other medicines, such as opiates. Based on that classification, we decided to divide the most widely used infusion pump mechanisms into two bigger groups as well. Those will be the roller and linear peristaltic mechanisms and syringe mechanisms. And the reason why we're, specifically pointing out those two different types of mechanisms in infusion devices is because each of them has different points of probable failure, and we'll talk in much more detail about this, in a few minutes. And the function of each of those mechanisms has its own impact on the fluid that is flowing through the infusion tubing, which in turn affects the testing process.
Katya, there's also one more kind. It would be in the large volume delivery kind of category here, and that is the little cassette kind that go into some of the infusion devices, IV pumps, and what they act more like an on-off valve. The peristaltic roller or linear delivery mechanisms actually are more of a continuous delivery. They don't start and stop, but this cassette is kind of a all on or all off, and it kind of goes off, on, off, on, off, on in order to control the amount of volume that delivered at the cost of less smooth flow delivery. So there's that kind also. The good news is all of them can be properly evaluated in terms of measurement to make sure that they're safe and effective for clinical use.
Correct. And so here I would like to just, on a higher level, comment on the differences between those two, and just, like Jerry gave you an overview of the cassette type of mechanism. The peristaltic ones, just like Jerry mentioned, they do the continuous flow. So the way they work is that the roller turns, or as the fingers and the linear peristaltic mechanisms move, the part of the tube that is under compression is pinched close, thus forcing the fluid to be pumped to move through the tube into patient's vein on a continuous basis. Today, that is the most sophisticated mechanism. It allows for delivery of large volumes of fluid, and it is it's most commonly used in delivering nutrition or in patient control analgesic. So syringe pumps, on the other hand, they use an electric driver that slowly depresses the syringe plunger. You can see it in the picture. There's a little syringe on top. So the plunger, when it's moved, it pushes the fluid into the patient's vein. Those mechanisms are great for low volume fluid delivery because they can infuse very small doses over a long period of time. However, here I would like to make a note also that the operators need to be very careful when they use the syringe pumps, as they may have sort of a mechanical slack that will not allow for steady flow rate from the get-go. They will need priming. All right, so now that we did this, overview of infusion devices and what they're used for, and now that we've established, thank you, Jerry, for your comments. We've established that they are really critical devices that are used in extensive care of oncology patients, or pretty much for any sort of condition in a hospital environment or at home. We also need to mention that there are a large number of adverse events that involve infusion devices that are reported to the FDA each and every single year. So what can go wrong when you use infusion pumps? So Jerry, if you would like to comment on this slide a little bit and elaborate on all the kind of the main points of failure that could be happening with infusion devices.
Sure. Sure. I'll be happy to elaborate a little bit. We all know that there can be false alarms in all kinds of medical devices, but especially in infusion pumps, some of the false alarms you can get have to do with air bubbles and obstruction or of the fluid line. Um, the important thing in the large volume kind of continuous flow pump mechanisms is our goal is a controlled flow of the infusate, the liquid, the drug or whatever it is that's being delivered to the patient. So sometimes, however, we need a free flow in an emergency situation. So that really is an important feature of the infusion pump that needs to be dealt with and made sure that it's working properly. Syringe pumps can sometimes cause siphoning, which means the wrong way flow uh, of uh, of the of the fluid, and sometimes you get blood backed up into the syringe. That's also not a good situation. So those can be caused by the IV pump itself downstream, mostly from the fluid bag, but upstream from the patient themselves. But it can produce harmful effects. If you fail to clear all the air bubbles out of the infusion set from the bag all the way down to where it's going to connect to the patient, that can push air into the bloodstream. That's never a good thing. Air in the bloodstream causes actually an occlusion in the bloodstream, and that air bubble can get stuck in smaller blood vessels near the brain, near the heart, and those things cause cardiac arrest or stroke. So we want to be very, very careful about air embolism. It is a deadly problem, so we want to make sure that that is not happening. Incorrect readings can always happen, and that's another reason why we test and run all the infusion pump through its paces with some sort of measurement system that allows us to evaluate whether the function of the infusion pump is working properly in accordance with the manufacturer's specifications.
Thank you, Jerry. So the biggest takeaway from this particular slide is that since infusion pumps are used to administer critical fluids, which include very high-risk medications, all of the pump failures that are possible, they can have very significant implications for patient safety, which is why you must test infusion pumps. That's the biggest takeaway. If there's one thing that you take away from this entire webinar, this is it, that we must perform tests on infusion devices. Here we have a few very general test recommendations. Before we dive deep into the test procedures and test methods, I would like to give this high-level overview of the recommendations that we have for infusion pump testing. First of all, you gotta test your infusion pumps annually, and we will talk about why in a few moments. You need to use manufacturer instructions and hospital protocols to follow the procedures. You need to consult with the standard. It's the IEC 60601-2-24. And you have to document the results of your test for traceability and compliance. Now let's move on into the infusion pump test procedure. So what does it comprise of? And so what are the major components? And we will dive a little bit deeper in a few moments from here. So typically an infusion pump is tested for flow volume accuracy, for occlusion pressure, for electrical safety, and also visual and physical inspection is being done. Preventative maintenance could also be included. For example, replacement of consumable or short-term durable parts of the pump. Like I said before, infusion pumps require preventative maintenance at least once a year. Hospitals generally test infusion pumps at incoming inspection for scheduled PMs and post-repair. And OEMs test infusion pumps for quality control. Preventative maintenance also includes verifying the pump is administering flow, volume, and boluses accordingly, accurately, and including appropriately. Yeah, I mean, this is really straightforward. I'm a little bit, I'm looking at the slide right now and I see how much information we have in it. And unfortunately, we do not have the time today to go really deep into every single one of those buckets, starting with visual inspection, then moving on to electrical safety, preventive maintenance, and then the performance test itself. But what I would like to focus on today would be the performance test. We will talk about various methods for the flow and volume accuracy and for occlusion detection pressure. So with volume flow accuracy, there are several different test instruments or systems that can be used to evaluate the accuracy, flow and volume of infusion pumps. So the first one would be the graduated burette. Sometimes it is used with a stopwatch to see the flow rate. The second one would be the Beaker and scale system for the volumetric and gravimetric weight, which converts to the volume in the beaker. And the last one would be the electronic burette, the electronic analyzer that already includes the stopwatch function. So all of these setups, they're appropriately accurate to assess the volume and flow accuracy of any infusion device. Each of them obviously has its own strengths and weaknesses, and we would like to share them with you so you would be aware of them, and also you could share that with the staff that operates them as well. We believe that only one of the setups allows the productivity improvement that is necessary to complete the testing on the entire fleet of infusion pumps that you might have in your institution. So we will start with the graduated burette. What is the strength of this particular method for testing the accuracy of volume and flow? So the strength is that it's accurate. The weakness would be that it is not automated. So it requires the operator to be dedicated to the testing one infusion channel at a time, or to be highly skilled to use multiple burettes and a stopwatch with sufficient, splits to capture the infusion beginning and at the end for each infusion channel, which is highly difficult. There is a relatively high error potential because of the improper viewing of the meniscus. You can see on the picture on the left how the burette has to be positioned straight from the eyes of the operator to ensure the correct reading. The other kind of cons to using that particular method is that you would still need other measurement devices to complete the PM of an infusion pump. And then there are, of course, such cons as, the lack of traceability and data documentation automatically. So you would have to perform the test manually, record everything manually. So it just adds a lot of trouble, a lot of waste to the process of doing the PM. So there's a longer test time that's associated with it. And like I said, you need more gadgets to complete the PM with the graduated burette.
I'd like to just weigh in just a little bit on the graduated burette, Katja. The problem here in accuracy, it's very accurate when the meniscus falls exactly on a graduation, but in between graduations, there is no accuracy.
Yes,
right?
Yes, that's a big thing.
Because there is no scale to assess it against. And now you're guessing. Might be an educated guess, but you're guessing. So that's the big problem, and that's what causes the human error here, primarily. Although Katja has pointed out that sometimes if you don't read the meniscus correctly, you can get some error built in there as well. It's very portable though, it's not expensive, those are strengths, But I think the big weakness here is when the meniscus falls between graduations, you're kind of toast.
Yes, that's a great point. That's a great point. All right, so now let's move on to the next setup. The next setup would be using the beaker and the scale. The benefits of this method and the weaknesses actually are pretty similar to the ones of the graduated burette. It is also very easy to set up. It requires minimal training of the operator. It's relatively accurate. However, there are also, the same setbacks with using that method, because again, you will need more gadgets to complete the PM for an infusion pump if you're using this for the volume and flow test. And it's also prone to human error. And here, actually, we would like to do a little quiz for you guys, because like we mentioned before, you need to use caution when using beaker and scale method because of the conversion between the milliliters and grams that you would have to calculate when you're measuring volume in the beaker in milliliters, and you're weighting the beaker in grams. So here's the little quiz that we prepared for you. So let's say you are using this test method to measure the accuracy of volume and flow. You're using water for the volumetric test. So in your opinion, how does 1 milliliter convert to 1 gram? So the options that we have here is that 1 milliliter is lighter than 1 gram. So you would have to incorporate that into the conversion. We're not even asking, the correct numbers or anything like that. Just, is it lighter? Is it heavier? Or does it equal to 1 gram? So what is your guys' opinion? Unfortunately, I personally cannot see the chat. So
yeah, if you guys want to use the chat, people are answering. We're getting some C's, a lot of C's.
Any other options?
Oh, I see an A.
Mm-hmm.
Couple A's, but majority are saying C, but a couple A's.
Well, that is great, because the correct answer is C. So when you're using water for your testing, 1 milliliter will equal to 1 gram. So it will be really easier for you to convert the measurements between the two, because they're equal. And that is one of the questions that we get fairly often, which is why we wanted to address it here.
We have one good point of clarification here from one of the participants, Katya. He points out that C is true only when we're using pure water. And of course, that's exactly what is recommended. It should be, in fact, deionized pure water, so not mixed with anything else. This is a testing infusate that should be being used properly. And then when we get back to it, I have another comment about the beaker and scale before we move on.
Sure.
So one of the other drawbacks to the beaker and scale is this. The scale is highly accurate. It's a really good measuring system. However, it's just one channel at a time, And that's a little bit of a productivity problem. Secondarily, scales cost more. If you're going to have very many infusion channels to test, whether it's one infusion device with multiple channels, or whether it's many, a large number of infusion devices, that scale costs more. And also it doesn't travel well. So if you are a traveling biomed and you're going to go to a client site, that scale has to be very, very carefully transported. Otherwise, it is not accurate anymore when you get where you're going. So you have to be careful to pick a testing system that is durable and able to withstand the transport bouncing around in your vehicle or on the airplane or however you got to get from point A to point B. There was a question I want to just get to really quickly before we go to the electronic analyzer. The question is, in terms of the measurements, should we then consider the temperature as well? And And that's not such a critical factor because the time frame during which we are going to be making measurements is short enough that the temperatures should not be changing drastically in terms of the temperature of the fluid nor the temperature in the room. So unless you are in some environment where you are not environmentally controlled in the testing location, the room, at the bench itself, or say, for example, we often worry about this in a low desert situation where the temperatures can get very high, especially towards the afternoon. Not only in the room, but it tends to over time heat up fluids as well and gases as well. But really, in the time frame during which we're doing these measurements and doing our testing, pump by pump, channel by channel, no, temperature's not a variable that we're worried about.
Thank you, Jerry. And now let's move on to the electronic analyzer. So just like any other method, it has its pros and cons to it. The biggest benefits to using an electronic analyzer for testing infusion devices that we see is obviously the increased productivity and a huge reduction in test time, because first of all, you can do simultaneous testing if you're using a multi-channel analyzer. So you can connect, multiple pumps to one analyzer and start your testing simultaneously. You can also use the electronic data documentation features in your analyzer as well. That will help you to improve compliance, traceability, and of course, reduce the human error in operation. We'll also see, some drawbacks of this method, such as some learning curve that's required. It may require some skill to learn to use. However, we think that the learning curve may be offset by the test automation software because it's very helpful in the process. Another potential weakness is that when using an electronic analyzers, you need to make sure that the channels are kept clean. The valves must be kept lubricated, and you need to use a special additive to infuse a liquid. And I mean, the price of this setup may be slightly higher than the other two. All right, so now let's move on to pressure measurement methods. So first of all, why do we need to perform pressure measurement when testing infusion pumps? I don't think I have covered this in the webinar just yet, but there are dynamic monitoring systems within infusion pumps that have the ability to monitor downstream pressure and rapidly detect any sort of occlusion or blockage. And as we mentioned before, the blockages in fluid delivery, they lead to infusion interruption, and it can be severely harmful to the patient if, for example, some very high-risk medication is being administered to that patient in the moment. Which is why most of the modern infusion pumps have safety systems that trigger an alarm sound when an internal pressure in the pump reaches a certain level, when an occlusion, or a blockage happens. So our goal is to check pressure in infusion pumps, as well as record the pressure level at which the occlusion alarm is activated to make sure that everything is working properly. So how can we do that? So there are two ways to do that. We can either use an analog gauge or a digital pressure meter as one sort of setup, or we can use the same digital analyzer that we talked about in the volume flow rate testing a slide before. Again, both have pros and cons to them. The analog gauge or the digital pressure meter that you could use, they will be accurate. I mean, there will be a short learning curve to it, if any at all, because they're familiar to most operators. However, they are not automatable. So there will be some, some time waste there. They will require the operator to be dedicated to testing because the operator needs to be there to record the parameters. And of course, they're limited to testing one infusion channel at a time, which is mitigated by using electronic analyzers, especially the multi-channel ones, when measuring pressure of the infusion pump. The rest of the benefits to use an electronic analyzer as a method of pressure management would be very similar to what we just discussed for volume and flow rate. Again, it reduces the manual error. It reduces time for completing the test. It allows for work standardization because of the test automation in it. And I mean, it's just the same setup that you're using for the entire procedure, the entire test procedure and test setup. So it's highly convenient. And then again, the weaknesses could be, the same. There's still some learning curve to it that could be mitigated by using software, and the price is higher than the other setup. All right, so now that we've discussed the test procedure for infusion pumps, we've discussed a few methods that could be used for different parts of the test procedure. Now let's move on to talking about how you could optimize your infusion test strategy. And I will let Jerry to speak to this.
Okay, thanks, Katja. The risk that we want to look at has to do with how likely is it that just because the patient is connected to an infusion pump, they may be harmed, be injured, or they may die. That's one view of taking a look at the risk, and we'll go through some of the others briefly. This is also covered, by the way, in another of our topics within the Advantage Training Center about medical device quality assurance testing, specifically about infusion delivery devices. So not just infusion pumps, but others as well. We need to ensure that we're complying with, first of all, the manufacturer's specifications. So that includes the testing limits around flow, the testing limits around volume, and the testing limits around pressure in terms of the infusion delivery. And then we're worried about time saving. So how can we efficiently do a thorough infusion device test and document all of the things that we did, whether they're the visual inspection section, whether they're electrical safety section, whether they're the preventive maintenance, if there's any that needs to be done, or whether it's the performance testing. How do we be efficient at collecting all of that information in an appropriate way so that we can finally get to, in the end of the day, things like failure rate of the infusion device brand and model that we're testing, and finally get to what we'll call predictive maintenance. So if something would need to be ordered and take a long time, how do we make sure we got the right part at the right time? So this risk assessment is mainly designed to make sure that we're doing the right testing at the right frequency of inspection. However, it does help us to think very, very thoroughly about the things that add risk to the patient relative to patient safety. There are 5 categories in this assessment worksheet, and in each of those categories, you're only going to pick one option, and then you're going to add up the whatever that weighting is. You're going to add that up and get a total risk score. So in this case, when the risk is 10 or higher, then what we're looking for is twice per year. If it's in the medium range between 8 and 10, then what we're looking for is once per year. So if it, in the case of infusion devices, it's never going to be any lower risk than that. So we're either going to look at it annually or twice per year. Now, depending on how you're looking at it and how the infusion device is used, what it's primarily used to deliver, let's go back to that chemotherapy situation. It's going to be used in oncology in the hospital. It's never going to be used anywhere else. We closely control with the set of infusion devices that are going to be used in oncology, and it's going to deliver chemotherapy. Now, you could argue that in that testing situation, we might need to test those infusion pumps twice per year because they're delivering such a critically volatile and uh, risky infusate, the chemotherapy drug itself, that could kill the patient if we're not careful. That's why we would take a look at that. And this worksheet helps us identify those things, maybe at a higher option choice in the particular categories that would give us a total risk score that would lead us to a twice per year evaluation. For general use, even for some of the pain management that happens in hospital beds around the hospital, not necessarily ICU, but other places as well, once per year is probably going to be enough. That's going to be okay. But in the OR, where we're delivering um, narcotics in a lot, where we're delivering sedation, IV conscious sedation like propofol, then we might also argue in that situation for a twice per year assessment. But this is covered in a very detailed way in the various courses under MDQA, Medical Device Quality Assurance Testing, in our Advantage Training Center. So automating the tests in terms of automatic documentation is really a really helpful thing. So if we have interoperability between this automation of the workflow and our infusion, our electronic analyzers, where we can collect the information automatically for each measurement, that really helps speed things. It helps us reduce human error. It helps us be more compliant to the source of the pass-fail criteria, the testing limits, which in our case is going to be the manufacturer's specifications in their test procedure from the service manual of the device. It's going to allow us to collect all of our actions in that workflow. So we already highlighted the sections of the workflow: the visual and physical inspection of the device, the electrical safety measurements around the device, the preventive maintenance that may be done in the performance tests. We can collect all of that and get just one test report at the end. And that's really important. It speeds everything up. In fact, if this automation system is also interoperable with your CMMS or database, then what can happen is the work assignment that was issued to you from that database might also be able to be automatically closed for you on the basis of an overall test status of pass. So everything you looked at, everything that you measured for electrical safety, all the performance checks, all of those were pass. The interoperable system with your database could automatically close the work assignment. Really saves you time when you think about it. You don't have to go back and close it after the fact. It doesn't delay your speed of getting things done. And so efficiency produces productivity, helps you with compliance, and now your whole medical device quality assurance program really helps you. And by collecting the actual measurements against the pass-fail criteria, we begin to have a trend, a long-term trend that we can look at and set something called trend limits that help us identify failure rates. And from failure rates, we can begin to identify what can we predict is going to happen. Okay, and then have the right parts at the right time to be able to do scheduled repairs. Okay, that reduces the amount of stuff that just shows up at the biomed shop door and it says broken, right? It can help reduce all of that. When you really run a system well, that's what you get. So we really think you should consider automating your testing and documentation. Okay.
So actually, I rushed a little bit and I switched to the next step already, where our recommendation to consider test automation also stems from the fact that it will save you significant time and reduce cost. And Jerry has already mentioned a few of those points already on, how first of all you can finish your procedure and immediately report all of the data to your CMMS or any other software database of your choice. So that will save you significant time. What test automation can also do is match test procedures to service manual protocols, which already reduces time significantly. Another great thing that you can integrate multiple testers into a single procedure for considerable time savings as well. So when you're using an electronic analyzer that has multiple channels in it, you can complete your PMs faster. Jared, do you have any more comments on this?
No, you made a good point, because what are all of the testing instruments that you would need, that you would prefer to be able to automatically collect measurements from? Well, certainly it's the infusion device analyzer, but it's also your safety analyzer, so your electrical safety. So where your electronic analyzer here also measures pressure, then you get your flow, volume, and pressure all the time. And each of those parameters could have its own independent testing limit. So in real time, while you're making the measurements, you're also assessing against the testing limits. So it really can speed you up. When you save time, you save money, and that reduces the cost of care and the cost of ownership of the medical device for the hospital.
Yeah, and we have actually performed cost analysis that shows that by using a 4-channel analyzer in a medium-sized hospital, you can see about $10,000 in annual savings by doing just that, which is...
Guess what? That just gave you money to buy the next analyzer if you need it.
I would like to thank you all for your attention and for staying with us today. And thank you, Jerry and Dan, for being here.